Hey everyone! In today's video, we're diving deep into the 12 surprising signs your liver might be in trouble. Your liver is like the body's unvalued hero, quietly working behind the scenes to filter toxins and keep everything running smoothly. Many think liver damage only happens because of excessive alcohol consumption, but that's not the whole picture. There are tons of misconceptions about how our livers get damaged and how our bodies cry out for help. We often miss the early warning signs, mistaking them for something less serious. That's why in this video we'll explore 12 unusual signs that your liver might be in trouble, signs you might not expect. Remember, this video is for informational purposes only and shouldn't be taken as medical advice. Always consult with your doctor for any health concerns. All right, let's talk about something nobody really wants to discuss: poop. But trust me, paying attention to your bowel movements can reveal a lot about your health, especially when it comes to your liver. Your liver produces bile, a digestive fluid that helps break down fats and gives your stool its normal brown color. When your liver is struggling, bile flow can be disrupted. This can lead to a lighter, clay-colored stool. It's like the pigment just goes missing. If you notice a sudden or persistent change in your stool color, especially if it becomes pale or chalky, get it checked out. Light-colored stool doesn't always mean liver problems. It could be caused by other factors like certain medications or dietary changes. If you see this sign alongside other symptoms, consult your doctor to rule out any underlying liver issues. Be your own health advocate and pay attention to what's going on in the bathroom. Early detection is key, and your liver will thank you for it. Now let's move on to the next sign, which might surprise you even more. This next sign might sound strange, but there's a fascinating connection between your liver and your vision. Specifically, we're talking about difficulty seeing at night or in low-light conditions. You might be thinking, what does my liver have to do with my eyes? Well, it all boils down to vitamin A. Vitamin A is essential for good vision, and your liver stores and converts it into a form our eyes can use. When your liver is damaged, it can affect its ability to metabolize vitamin A properly. This deficiency can lead to night blindness or difficulty adjusting to dim lighting. If you're experiencing persistent night blindness, especially with other liver-related symptoms, get your liver checked. Vision changes could be your liver trying to tell you something. Up next, we're talking about swollen feet. And no, it's not just from wearing uncomfortable shoes. All right, let's address the swollen foot in the room. If you're noticing swelling in your feet, particularly your right foot, it might be easy to brush it off as fatigue or maybe too much salt in your diet. However, persistent swelling, especially when accompanied by other symptoms on this list, could indicate a liver issue. But how can your liver cause your foot to swell? It all comes down to a large vein called the portal vein. This vein carries blood from your digestive organs to your liver. When your liver is damaged, it can create a blockage or increased pressure in the portal vein. This pressure can cause fluid to back up, leading to swelling in the legs and feet, particularly the right side. It's like a traffic jam in your veins. If you notice persistent swelling in your right foot, especially if it's accompanied by other signs on this list, consult your doctor to rule out any underlying liver issues. Early detection and treatment are key to preventing further complications. Next up, we'll discuss a rather unusual sign: white growths on your eyelids. You won't want to miss this one. All right, guys, let's talk about something you might not expect: those little white bumps that sometimes pop up around our eyelids. While they might seem harmless, they could actually be a subtle sign of an underlying liver issue. These tiny bumps, often called xanthelasma, are actually cholesterol deposits. When your liver isn't functioning optimally, it can struggle to regulate cholesterol levels in your blood. This can lead to a buildup of cholesterol, which can then get deposited in various parts of the body, including those tiny blood vessels around your eyelids. That's why seeing these white eyelid growths can sometimes be a sign that your liver isn't efficiently processing fats and cholesterol. If you notice these bumps appearing, especially if you have a family history of liver disease, it's best to get checked out by your doctor. It's always better to be safe than sorry, right? Early detection can make a world of difference in managing your liver health. Up next, we'll delve into another surprising sign: a feeling of pressure on the right side of your body. Stick around to learn more. Have you ever experienced a nagging discomfort or a feeling of pressure on the right side of your body, just below your ribs? It's worth considering that your liver might be trying to tell you something. Your liver is located on the right side of your abdomen, just below your diaphragm. When your liver is inflamed or enlarged, it can press against the surrounding organs and tissues, causing discomfort or even pain in that area. One of the main culprits behind this pressure is often related to bile. When your liver isn't functioning properly, bile flow can be disrupted. This can lead to a buildup of bile, putting pressure on the liver and surrounding tissues. If you experience persistent pressure or pain in that area, especially if it's accompanied by other symptoms on this list, it's essential to consult your doctor to rule out any underlying liver issues. Up next, we're talking about a more visible sign, the appearance of unusual spots on your skin. We've all experienced our fair share of bumps and bruises, but have you noticed an increase in unexplained bruising or the appearance of tiny red or purple spots on your skin? These could potentially signal a problem with your liver. Your liver plays a vital role in producing proteins essential for blood clotting. These clotting factors help prevent excessive bleeding when we get injured. When your liver is damaged, its ability to produce these clotting factors can be compromised. This can make you more susceptible to bruising and bleeding, even from minor bumps. These tiny red or purple spots, known as petechiae, occur when blood leaks from small capillaries under the skin. If you notice an increase in unexplained bruising, consult your doctor to rule out any underlying liver issues. Next up, we'll explore a surprising connection between your liver and the health of your heels. Stay tuned. We often associate cracked heels with dry weather or maybe not moisturizing enough. But did you know they could also be a sign of a vitamin deficiency linked to your liver? That's right. Those dry, cracked heels might be trying to tell you something about your liver health. One of the key nutrients involved in skin health is vitamin B3, also known as niacin. Your liver needs niacin to function properly and to help your body absorb other essential vitamins. When your liver is struggling, it can affect its ability to utilize niacin effectively. This deficiency can manifest in various ways, including dry, cracked skin, particularly on your heels. If you experience persistent or severe cracking, it's worth having a conversation with your doctor to rule out any underlying liver issues. Up next, we'll explore another itchy sign. This time, it's all about your palms and soles. We've all experienced the occasional itch, but have you ever noticed persistent itching, particularly on your palms and soles? This seemingly minor annoyance could actually be a sign of an underlying liver issue. So, what's the connection between your liver and itchy palms and soles? It all comes down to bile acid, a key component of bile produced by your liver. When your liver is damaged, bile flow can be obstructed, leading to a buildup of bile acids in the bloodstream. This excess bile acid can deposit under the skin, causing intense itching, especially on the palms and soles. If you experience persistent and unexplained itching, consult your doctor to rule out liver issues. Up next, we'll discuss a subtle but significant sign related to your nails. Stay tuned. We often focus on our skin and hair, but did you know that your nails can provide valuable insights into your overall health, including your liver function? Those little plates on your fingertips can reveal a lot about what's going on inside your body. One telltale sign of liver trouble is a condition called Terry's nails. In Terry's nails, the tips of the nails appear white, while the lower portion of the nail bed may look red or brown. This distinct white discoloration often covers most of the nail, leaving just a narrow pink or brown band at the top. While the exact cause of Terry's nails isn't fully understood, it's often associated with advanced liver disease, particularly cirrhosis. The changes in nail appearance are thought to be related to alterations in blood flow and protein production, both of which can be affected by liver dysfunction. If you notice these changes in your nails, especially if you have other risk factors for liver disease, it's essential to consult your doctor for proper diagnosis and treatment. Next up, we'll discuss another sign related to bodily fluids. This time, it's about the color of your urine. Okay, guys, let's talk about something we don't usually discuss in polite company P. But hey, It's a natural bodily function, and paying attention to it can provide valuable insights into our health, especially when it comes to our liver. The color of your urine can tell us a lot about what's going on inside our bodies. When it comes to liver health, one of the key things to look out for is dark-colored urine. Normally, our urine is a pale yellow color due to a pigment called urobilin. Urobilin is a breakdown product of bilirubin, produced during the recycling of red blood cells. Your liver plays a crucial role in processing and excreting bilirubin. When your liver is damaged, it may not remove bilirubin efficiently. This can lead to a buildup of bilirubin in the blood, spilling over into your urine, giving it a dark yellow, orange, or brown color. If you notice persistent darkening of your urine, especially with other symptoms, consult your doctor. Next up, we'll discuss a more well-known sign of liver trouble: jaundice. One of the more well-known signs of liver trouble is jaundice, a condition that causes a yellowing of the skin and the whites of the eyes. Jaundice is a clear indication that something is amiss with your liver function. Just like dark urine, jaundice is related to bilirubin. Bilirubin is a yellow pigment produced during the breakdown of red blood cells. Normally, your liver processes bilirubin and excretes it from the body. When your liver is damaged, it can't process bilirubin efficiently, causing it to build up in the bloodstream. As bilirubin levels rise, it gets deposited in the skin and eyes, giving them a yellowish tint. If you notice a yellowing of your skin or eyes, consult your doctor immediately. Up next, we'll discuss our final sign, the appearance of spider veins. We often associate spider veins with aging or genetics, but did you know that they could also be a sign of an underlying liver issue? Those tiny web-like veins, especially if they appear suddenly or increase in number, could be your body's way of signaling a problem with your liver. So what's the connection between spider veins and liver health? It all comes down to estrogen. Your liver is responsible for breaking down and removing excess estrogen from the body. When your liver is damaged, it can't metabolize estrogen efficiently, leading to a buildup in the bloodstream. This can contribute to the formation of spider veins. Excess estrogen can weaken the walls of small blood vessels, making them more likely to dilate and become visible through the skin. These veins often appear as clusters of thin, red, blue, or purple lines on the skin, commonly found on the face, neck, chest, and legs. While not everyone with spider veins has liver problems, if you notice a sudden appearance or worsening of spider veins, especially with other symptoms on this list, consult your doctor to rule out any underlying liver issues. Now, let's recap what we've learned about the surprising signs of liver trouble. We've covered a lot today, from changes in stool color to itchy palms, and even those tiny spider veins. Your liver is an incredible organ, working tirelessly to keep you healthy. Early detection is key to preventing long-term damage. If you experience any of the signs we've discussed, especially if you have multiple symptoms or a family history of liver disease, don't ignore them. Talk to your doctor, get the necessary tests, and address any underlying issues. Your liver will thank you for it. Simple lifestyle changes like maintaining a healthy weight, eating a balanced diet, limiting alcohol consumption, and managing underlying health conditions can support your liver health. Take care of your liver and it will take care of you.